present very briefly an overview of the talks that have sort of preceded this morning, and also some of the posters that you'll be able to go and see, and I very much encourage all of you to go along and see the posters for the cancer session today, and also vote on them, because there'll be an award presented to the best poster presentation tomorrow. Also, some of the ones I'm reviewing will not have been presented because of time constraints, so but I will review those abstracts anyway. Just briefly to say about EPMA's mission. As you know, there's 43 countries presently here this last few days, and some of the missions sort of condensed includes adequate health care investment, creating novel technologies, all the stuff that we've discussed over the last couple of days. Development of non- or minimally invasive diagnostic tools is a really important mission for EPMA. And also knowledge exchange, something that we're doing all the time since we've arrived in Bonn, between biomedical researchers and biotechnology companies for this advancement of diagnostic tool production. So to put cancer into context, I just thought I'd present some figures that were released quite recently by the World Cancer Research Fund. Globally, there's been a 20% increase in new cancer cases in less than 10 years. That's approximates to around 12 million cases per year. And of these, 2.8 million cases are thought to be linked to diet, physical activity and weight. And so it's thought the World Cancer Research Fund therefore says that roughly 1 in 4 cancers are, they think, are preventable by lifestyle changes. Bring it closer to home in Europe, a recent paper by Fairlight out in 2008 estimated cancer incidence and mortality in Europe and looked at 25 different cancers in 40 countries. And they showed 3.2 million new cases with 1.7 million deaths, with the most common cancers being colorectal, breast, lung and prostate. And the most common causes of death, again, being lung, colorectal, breast and stomach, making it into the top 4. So we see a commonality between these three cancers of lung, colorectal and breast being responsible both for cancers and for death from cancer. And so PPPM in cancer is a crucial area for improving survival rates and quality of life in Europe. So the areas under discussion today have been biomarkers, genomics, proteomics, dietary contribution, vitamin D, immune system disorders and childhood infections leading to malignancies. Today we had Prof. Characiejus, and he summarised basically the evidence that is available on the potential for some oncology therapies actually inducing cancer or metastasis in some patients, and how survival may be improved by not ignoring these negative effects of chemotherapy. Let's look at both positive and negative effects. Dr. Charles Swanton, unfortunately, is not able to attend today, but he has an abstract basically reviewing the fact that of 150,000 cancer biomarkers that are in the literature, only 100 are currently in clinical use. And the question is begged, why do we have so few, and why is there so many identified and not in use? Just looking at breast cancer as one of the most common cancer settings for women, I'm just presenting this graph of data from 2002, 2000 to 2003, showing that survival overall, we have Iceland at the top with the highest levels of 5-year survival rates, up to around about 90%, all the way down to the Czech Republic. And we can see that survival has increased in breast cancer patients, but there's still room for improvement. At the UK, for instance, is in positions 14 to 17, and much lower than the USA. So I thought I'd box them together according to techniques on some of these summaries. So I thought we'll look at the use of genomics, because that's been covered quite comprehensively so far in PPM of breast cancer. And we have, of course, the last speaker, Dr. Melanie, on the NTRs in HER2 breast cancer. And he discussed how basically HER2 amplification occurs in 20 to 30% of breast cancer cases and predicts the relapses and short-term survival. VNTRs are used in forensics and may affect replication DNA strand length breaks, and the potential use of VNTRs as possible prediction of therapeutic targets. We had Dr. Michael Norman, who's talking about gene expression in breast cancer patients, He also won an EPMA Journal Award in 2010, and he looked at the use of generics in predicting patient response and how this can benefit the patient by allowing more personalised allocation of drug regimes, and it also indicates the potential for new drug targets. Continuing generics, we have Daniela Trott has an abstract, she's not presenting, and she was looking at generics for malignant gliomas, which is the most common adult brain tumour and has a high mortality rate. And her interest is in MGMT gene silencing, which you get increased survival in patients with hypermethylation of the MGMT gene when they're treated specifically with TMZ. However, wide variations occur in these patients in the response to this drug, and so this indicates that other gene predictors alongside methylation status of MGMT are required to improve the patient response. So this could include primary cell cultures from the patients as well. And continuing the generics theme, we have Marcia Del Rey was going to present a poster. She has definitely had an abstract looking at risk areas in colorectal cancer therapy. And her study looks at the use of pharmacogenomics, another thing that's come up quite regularly in the talks, to look at oxaliplatin-induced neurotoxicity of patients in order to specifically identify patients who would be at risk from developing that. And this would allow us to personalise and optimising chemotherapy for those patients. Dr. Martin Peshter has just spoken very at length on miRNAs and colorectal cancer and his use of TACMAN to assess microRNAs as prognostic tools. And he showed, obviously, this shorter disease-free time of overexpression. Obviously, the NEO-143 one, it needs further investigation because they've got some unusual results with lower expression of that. But all of the data seems to point towards this shorter disease-free time of overexpression, again indicating potential therapeutic targets or prognostic tools. So is there potential for proteomics in cancer?